My name is Mohan Raj. My matric card ID number is 10DEE18F1089. Our topic is about occupational first aid. Identification. Airway. Is it open? Minimize your neck movement as much as possible and apply clavicular collar if accessible. Breathing. Is that casualty breathing? Look, listen and feel. Administer artificial respiration if required. Circulation. Is there a carotid pulse? Is that severe bleeding? If the heart has stopped, give heart compression and artificial respiration and RS series bleeding. Disability. Is there injury to the nervous and musculoskeletal system? Arrange the casualty in the most comfortable position possible. Exposure. Remove casualty from the offending environment. Place tent over the casualty if available. Requirement under the first aid guidelines by OSH. It is the legal duty of an employer to provide information, instruction, training and supervision about first aid facilities and services for workers. There are four major components of workplace first aid required by OSH, namely first aider, first aid box, first aid room, first aid equipment. The decision on the number of major workplace first aid components depends on the following factors: type of industry, number of workers, number of work shifts, locality and status of infrastructure of workplace in relation to the nearest medical clinic and hospital.
Nama saya Danesh Nalaki Maripan. Nombor matriks kad saya ialah 10DEE18F1095 dari kelas DEE1C. Hari ni saya nak cakap pasal assessment. Once it has been ascertained that there is no promote danger to life, there will be time to assess circumference, consolation and quick effective consideration to injuries and compassionate treatment of the injured person will allay his and her condition. When a victim refuses to care, do not proceed. Check for injuries. Examine of the victim thoroughly and note the abnormal signs and symptoms. Obtain as much information as possible and give the information to the correct authorities. Keep in mind, a calm and correct approach should be adopted. Give nothing by mouth if its casualty is unconscious or vomiting. Protect the casualty from cold and heat. Work quickly but in an organized and efficient manner. Try not to diagnose or talk about the casualty's condition with observers at the scene. It is fundamental to keep a secrecy and to secure the casualty's right to privacy while giving treatment. Do not underestimate the situation and do not regret the following as minor injuries: unconsciousness, suspected internal bleeding, stab or punctured wounds, wounds near joints, possible fracture, and eye injuries. All that's one.
Hi, good evening. My name is Nufarsha bint Abdul Rashid and my matric card is 10DEE18F1121. Okay, my topic is about to control the principle of first aid. Firstly, when the scene is not safe, it is the responsibility of the first person at the scene to call for medical help. And then inform next of kind and give the complete report to the authorities, such as details, location, date and times of the incident and the person who is involved. And then, if the casualty is bleeding, controlling the bleeding is priority. So here is the way that can be used to control the bleeding, such as direct pressure, elevation, pressure bandage and pressure points. Next, use protective barriers such as glove and polythene bag to control bleeding and thick layers of dressing. Then avoid any direct contact with blood to preventing from infection. Then wash your hand after providing first aid, and finally, when the casualty is breathing normally, place in the recovery position. Thank you.
My name is Muhammad Zikri Muhammad Nizar. My matric card number is 10DE18F1120. I will talk about first aid box. First aid box should be made of strong material, compact and movable, so it can be taken to the site of an accident easily. The first aid box should be clearly marked and must not be kept under lock and key. If locked, the key must be kept by a responsible person, like available during all working hours. Each first aid box should be put in an obviously identifiable, well illuminated and accessible location. Each laboratory and workshop should have a first aid box within easy reach. Each laboratory and workshop should have a first aid box within easy reach. For vast work areas, the satisfactory number of first aid box should be provided. The employee should be informed of the location of all first aid box. When choosing a location, consider the temperature of the surrounding area to prevent damage to the content of the box. First aid box should contain sufficient and suitable quantities of first aid material. The box should not contain any oral medication of any sort other than those needed for first aid treatment. It is essential that first aid box be checked as often as possible in order to verify that they are completely equipped and all items are usable. Used material should be replaced as soon as possible. Thank you.
Start.
Hi, my name is Sivanandan Alagivasu. My matrix card number is 10D18F1096. Today my topic will be first aid equipment. First aid equipment is a compulsory in a workplace where there is a high risk of setbacks. Necessary equipment such as stretchers, wheelchairs, sheets, covers and bandages. It is vital that people are treated immediately and an ambulance can be called for several cases. Any industry that utilizes substances hazardous to health, a chemical safety data sheet should be kept in noticeable spot when the chemical in use and accessible to employees. Training such as early management and instance chemical poisoning or decontamination should be given to any others that work for the organization in chemical sources. Protective clothing and safety gear should be provided where there is a likelihood that the first aid may be require protection while giving emergency treatment. Protective attire and equipment should be properly kept, regularly checked and guaranteed by the safety management. The danger of transferable infection is a risk of performing emergency treatment. As a first aider, universal precautions measures are encouraged while dealing with an injured person. Extra provisions should be taken when there is the possibility of interacting with the blood or body fluids. It is endorsed that a first aider is immunized for hepatitis B.